How much do GPs earn in Australia? Today we're talking about GP earning in Australia. The earning potential for GPs is very good in Australia. GPs in Australia generally attract higher pay than their colleagues in the UK. Hi, my name is Dr. Erwin Kwun. I'm a GP working in the UK. In this video, I will break down the take-home pay of GPs in Australia. The Australian healthcare system is different to the NHS. In Australia, healthcare providers charge for each service rendered. Providers bill patients, the insurance or Medicare, which is a publicly funded universal healthcare insurance scheme in Australia. GPs work as individual contractors and are almost never salaried. The vast majority of GPs in Australia are self-employed. The income GPs generate is from a percentage of the billing. Practices will take a percentage of the billing as a service fee. The remainder, a percentage rate that varies between 60 and 70%, will go to the GP. What are the commonly billed services? Commonly billed items include item number 23. Item 23 is a professional attendance by a GP at consulting rooms lasting less than 20 minutes. And this could include taking a history, performing a clinical examination, arranging any necessary investigation, implementing a management plan, and providing appropriate preventive healthcare. The fee for this service is approximately $39. Healthcare providers can also bill item 10991. This is a concession for medical services or service provided in a rural or remote area. Healthcare providers are incentivized to bulk bill instead of billing patients where patients may have to pay out of pocket. Bulk billing is an option where healthcare providers will bill Medicare instead of the patient. The fee for this service is $11.60. Another service that healthcare provider may bill would include review of mental health care plan. This is item 2712, and the fee for this service is $74.60. This includes a review by a GP about a mental health treatment plan. Let's go over a working example of a GP who sees an average of 5 patients per hour. So the first patient, the GP will bill for item 23 and item 10991. Second patient, the GP bills for item 23 and item 10991. The third patient, the GP had to spend a little bit longer time and made a review of a mental health care plan. So the bill for this one would include item 23, item 10991, and item 2712. The last two patients, the GP didn't have to do a mental health review. So the bill would be including item 23 and item 10991. From this 1 hour of work, the GP is going to bill $328. And out of this $328, 65% of that percentage will go to the GP and the remainder will go to the practice as a fee. So this will give the GP with a remaining of $213 per hour. Now let's assume the GP works 8 hours a day. This will give a sum of $1,700. That is equal to £960 a day. Let's assume the GP works 47 weeks a year and works 3 days a week. That will give a total of $239,700 of annual income, which is equal to 135k in pound. If the GP is working 4 days a week, that will give a total of $319,600, which is equal to 180k in pound. If the GP is working 5 days a week, then the income will be higher at $399,500, which is equal to 225k in pound. GPs can earn even more if they're working out of hours during weekend or if they're doing extra shift. The figures we have talked about so far are pre-tax income. We need to factor in income tax and medical levy. That will give us the take home of a GP. Tax in Australia is progressive, and depending on how much somebody is making, then they will have to pay higher tax. With an income of $239,700, the GP will take home approximately $156,300, which is equal to £88,000. For 4 days of work per week, the GP will be making $198,700 after tax, which is equal to 112 grand in pound. For 5 working days per week, a GP will make post-tax 241,000, and this is equal to 136 grand in pound. How does that compare to a GP working in the UK? Let's assume we have a GP who is locuming at an hourly rate of £85 an hour and works 47 weeks a year. For one working day of 8 hours, the GP will be making £680 a day. If the GP is working 3 days a week, that will give us £95,880, and post-tax that would be approximately £64,300. For 4-day working week, that will give £127,840 pre-tax, and post-tax £77,800. If the locum GP is working 5 days a week, which is very intense, that will give a total sum of £159,800 pre-tax and post-tax of £95,900. Based on these two examples, as you can see, GPs in Australia have a high earning potential compared to the UK. GP partners in the UK on average make £121,800 pre-tax in England, and post-tax that will be £74,300. The figures in this video are purely estimates for information purpose only, but you can get an idea as to what is the earning potential of a GP in Australia. If you're considering to work in Australia, be sure to do your own research. In the first year after leaving the UK, you may find that you may not achieve this earning because you need to build your patient base. In the working example, we have assumed that the GP is fully booked and there are no times when the GP is not seeing patients. So in reality, there might be times when the clinic is not that busy. So depending on the practice where you're working, the patient base that you've got, then the earning of the GP will vary. If you found this video useful, then you might be interested to learn how you can make an extra source of income as a doctor. Click the video to watch it. Take care everybody. Bye bye.